Dr. Dorian said she would like for the panel to be challenged. So I challenge you to challenge them. And I believe that you do have cards, and I would like for you to ask some questions. Okay? We're going to start, and we've got some questions already prepared. And the first one is, we understand, panel, that there is no single overarching theological view of the HIV epidemic or the response of the faith community. There are many such views. What are ways in which your organization or your ministry can welcome a relationship with public health, provided that the relationship remains compatible with your religious perspectives and your community obligations? And we'll start with Reverend Brenda Gregg.
Can you hear me? First of all, I have the privilege of serving on the Pittsburgh Actions Task Force and AIDS Task Force, and probably have perhaps a lot more information than a lot of pastors get the opportunity to have in regards to this particular disease. There are many, many partners that are out here that we need to get to know. Some of them are not compatible with our views, and some of them are not open to be compatible, but you won't know that until you begin to work with them. I have found that just being available and being open to talk to the many services that are available to us, and to get to know whether or not that's a service that you feel comfortable in bringing into your church or into your organization. Even if we have different views, that doesn't mean that we could not necessarily work together. And so you have to know the organization, know what they offer, and know how you can partner with that particular organization. The church has remained silent too long. And so we as a church body have to pick up this particular issue and speak about it in our pulpits. And not only just speak about it in our pulpits, but open our doors up to other organizations that they might be able to come in and do things like testing at the church. And even the fact that T.D. Jakes did not do so, we have hundreds of churches here in Pennsylvania and Pittsburgh. We can begin right here in our own community. We can begin even on our small churches, our large churches, our storefront churches. We can begin to talk about this epidemic and also to partner with the many AIDS organizations that are here in our community. And we do have some good AIDS organizations, but we have to go and find out about each and every one of them and whether or not they have individuals who would partner with us in the way we believe we can be accountable for.
Does anyone want to add to that? Specifically, want to hear from the ministers on this question.
First of all, T.D. Jakes is not the author and finisher of our faith.
Amen. Thank God.
So our foundation is in Jesus Christ. To piggyback on Pastor Gregg, it's important for us to establish a relationship with organizations and agencies, just like we're educated about high blood pressure and diabetes and cancer and arthritic conditions. We go to the doctor for that, and we get pamphlets, and we come back to our church and we ask for prayer. Well, with that same education about HIV and AIDS, let's bring it back to the church and desire prayer concerning healing and caring for those who are infected and affected with HIV and AIDS. We know that we serve a compassionate God. Jesus went about in the synagogues preaching and teaching and showing compassion among the people and healing them. And the church has to become more compassionate and less judgmental concerning people with HIV and AIDS, because we know we all have sinned and come short to the glory of God, whether you lied or cheated or fornicated or whatever. God is a forgiving God, and He's a healing God. So I encourage the church and the congregation and the pastors to become more compassionate and to allow the education to be brought into the church so we can be educated concerning HIV and AIDS. Thank you.
Do any of you have health ministries in your church that deal with AIDS awareness and AIDS prevention? And if so, how do you conduct the programs that you conduct? How do you motivate the people to get involved? And do you feel that it has to start, it needs to start at the top from the pastor on down? Anyone can address that? Yes.
Again, I am Coffrey Biff. I'm a member of one church, and one church is led by Pastor Derek Tynes. We actually are operating out of downtown, and what we've done is extended an organization called One Life. And we essentially are doing HIV/AIDS testing in locations that the MSM community is in. We are located downtown. We have developed relationships with a lot of the young people. They know that we're a safe place and a safe place for them to go. And so we've been testing numbers pretty good. But we also have extended beyond that in terms of some of the other things that are needed to uplift young people, and that is self-esteem building, job readiness, and all those kinds of things that I think go a long way in affirming their lives, particularly when it comes to, I'm going to talk about the MSM community and faith. There's a disconnect. We believe that we're children of God. And we are unique in our own way, and we have that kind of, when we don't feel affirmed from our community, from our church, we devalue ourselves. That devaluing of ourselves goes unconsciously or consciously into a devaluing of what I do and what I am and what my behavior is. I don't care. Nobody else cares about me, so I don't care about myself, and that kind of goes into that. So what we try to do is give young people a really firm, a soft place to fall, to be encouraged, to be uplifted in the Word of God, but also get a prevention message.
What's used to educate your young people, sir?
Well, we do a number of just roundtables, and we do community meetings where we talk about any number of issues, and they're not just really on HIV and AIDS. They're really about lifestyle, really about making healthy choices, about creating a strategic plan for your life, because we want to get you thinking about, young people are really thinking about right now, and we wanted to get about what do you want to be doing when you're 25, when you're 30, when you're 35, and really sitting down and helping them direct and guide, develop a strategic plan so that they can start working towards that.
How many are working with public health in the education process in your ministry? Does anyone want to elaborate on what you're doing?
As far as the University of Pittsburgh in the public health approach, my Part D, Title IV, which is Women, Infant, and Children, and coordination of counseling and testing. As far as the church is concerned, how we collaborate is on offering our services, having a discussion of what the needs of the church is as far as HIV testing, which is sometimes limited in that setting. But the message should be to train those to do HIV prevention counseling, to set up a program. The Southwestern Pennsylvania AIDS Coalition offer classes throughout the year where individuals could come and get educated to do the prevention message. At the University of Pittsburgh, if an organization is willing to set up a program for counseling and testing, we do the OraSure or the rapid test. We would love to sit down and collaborate. We would love to, network, collaborate on that. So that's what we're doing. We've been out there, national events, and we try to work with many churches to do rapid HIV testing or just testing in general.
The Pennsylvania and Allegheny County Health Departments are also willing to work with you. I work for the state health department. I have a health ministry at my church.